Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Hello, my name is Dr. Kimberly Scott, and it is an honor to be part of this podcast today, The Story of Success, the legacy of African American innovators in the healthcare and educational technology. I have been part of the Keiser University family for over 10 years in the capacity of an instructor, a program director, and I am happy to be part of the eCampus in regards to medical assistant program and medical billing and coding program. My background encompasses being a healthcare professional as well as a business professional. I teach both healthcare courses as well as business courses. Recently, I actually had the opportunity to return to school to gain more information, to gain more knowledge surrounding public health, which is a grand segue to this particular podcast. When we think of public health, it deals with the community. It deals with the whole of a community versus just an individual or perhaps at that individual level. On that note, thank you, and I am happy to be part of this podcast. I want to start off with a quote in 3 words that you will continue to hear repeatedly in this podcast. This quote is to inspire future innovators in healthcare and educational technology. And the words are used to show the significance of the power we as individuals can continue to work to make a change. So I've written down a quote by Angela Davis, and that quote is, "We have to talk about liberating minds as well as liberating society." The 3 words that I want everyone to remember as we go through this podcast will be the acronym EAE. E stands for education, A stands for awareness, and E stands for engagement. Our first question, or perhaps the first question that I would like to discuss is, who are some of the key African American innovators in healthcare and educational technology? And what are their most significant contributions? There are many African American innovators who have made a significant contribution to healthcare, to education in general. Thinking about these innovators, we could be here all day long. However, I will name a few notable contributions that I believe as a healthcare educator, someone who is very passionate about healthcare, who have made a difference in this particular industry. Many of you have probably heard of some of these individuals, but if you have not, then I definitely want to just go through a couple of them. So first we have Dr. Daniel Hale Williams. And Dr. Williams is known as one of the first open heart surgeons, or perhaps performing one of the first open heart surgeries. He's also known as founding the first Black-owned hospital in Chicago. When we look at what this means, because this is significant, when we look at what it means, it is that it is an example for other African Americans. It is an example for others, who are striving to be a physician, those who are striving to become that specialist, maybe those who are a minority, maybe even those who are male, and whether they live in Chicago or perhaps outside of Chicago. It gives them the encouragement to achieve their dream, regardless of certain factors. And also, when we look at this is a contribution to healthcare through services and expertise. Another notable individual that I want to mention is Dr. Charles Drew. Dr. Drew is also a medical doctor. He is known as contributing to the changing of the blood transfusion storage. So he's known for the contribution of changing a blood transfusion storage. Think about this for a moment. When we think of blood is a necessity. We all need blood to survive. Okay, it is definitely needed. So what if this necessity had no way of being securely stored? In other words, what if there was no storage for blood? What if the person who needed the blood was in another state? What if the person who needed the blood was far away? What if, because of the storage issue, blood plasma transfusions could not be performed? In fact, we would be in trouble. Think about the men in World War II. They would not have survived. Many of us, we've lost loved ones, maybe due to issues concerning blood, maybe issues concerning not having that blood in a timely manner, or not having access to that blood. This is where Dr. Drew's contribution to technology and healthcare, I would say, extended beyond this point and into what we know as one of a great organization, which is the American Red Cross Services today. Let's go on to take a look at Dr. Patricia Bath. Dr. Patricia Bath is very famous. Many of you have probably heard of her. She's also a medical doctor. She's an ophthalmologist. She's a female. She's an African American. She is the one who invented the laser phaco probe. This is actually used to treat in the treatments of cataracts. Think about that. So this is a device which is considered a piece of technology. It's used in many procedures, dealing with the eye in layman terms. And when we look at this is a significant contribution to healthcare. Today, and I am just going from a local source. This is not even a national or an international source. This is simply just, me just sticking in the topic cataracts and finding a very local center, the West Boca Eye Center. Okay, today approximately half of Americans will have cataracts by the age of 80. This is not to say how many of those individuals who will need surgery, not to say how many of those individuals, if it wasn't because of Dr. Bath, who invented this laser phaco probe for this cataract treatment, who knows what would be. Another individual, and I mean, like I said, this can go on and on. We can talk about so many contributions by so many African American innovators. But I wanted to at least give a diversity of male and females, and I kind of stick with the medical doctors, although this is not to discredit or discount any of those other individuals who have made contributions to this field, whether through healthcare or just education in general, or perhaps even technology. So my last individual here is Dr. Jane Cook. Dr. Jane Cook is a medical doctor. Dr. Jane Cook Wright. Dr. Jane Cook Wright is a medical doctor as well. And alongside her father, she researched chemotherapy drugs. Now, I have not done research on how many individuals have cancer. I have not done research on how many individuals are receiving chemotherapy treatment. However, think about your loved ones. Maybe this hits close to home for those individuals who have loved ones who have cancer, who is going through chemotherapy treatment. Imagine at some point in time, if it wasn't for Dr. Wright and her father researching chemotherapy drugs, would that treatment option not be an option? So in all, these are individuals who played a major role in inventions and actually inspired, and who are viewed as inspiring those with diverse backgrounds to contribute to healthcare and education in general. Another point that I want to talk about is in what ways have African American initiatives impacted health outcomes and educational achievements? This is a very important question. This is a great question because this is where we have to think in terms of as an African American community, and I won't even limit it to that, as a community in general, regardless of the ethnicity or the nationality or the race. What initiatives are there in general for even any individuals who would be considered as minorities, or perhaps those individuals who are less fortunate that may not have the resources to contribute the way that they wish to contribute to this field? So again, let me repeat this question and then I'll go ahead and answer the question. So in what ways have African American initiatives impacted health outcomes and educational achievements? I would say in the ways of developing health educational campaigns. There are many health educational campaigns. You know, as a public health professional, going through my education, part of my education, if not all of my education, really dealt with the level of the community. Not so much at the level of the individual, but the level of a community and how and what changes need to be made in order for that community to improve on whether we're talking about health disparities, health initiatives. And also part of that was the health educational campaigns that dealt with awareness. So remember, let's go back to the three words that I discussed earlier, the EAE, the education, awareness, and engagement. So this is where you have these campaigns where they deal with awareness, they deal with advocacy, they deal with promoting health equity, they deal with decreasing health disparities. All of this surrounding diseases that are prominent within the African American communities. So some of those diseases, this makes me think back to a project that I worked on, a community-based participatory project dealing with diabetes within the African American community, right here in our own community in Palm Beach County, Florida. So looking at this in general, some of those some programs, some initiatives, some awareness projects, they deal with disparities or perhaps conditions such as HIV, AIDS. They deal with hypertension. They deal with one of the most prominent ones, which would be diabetes. All of these affect the African American community. So in what ways have African American initiatives impacted? Well, we have these community-based programs where these initiatives are really to focus on addressing these healthcare disparities that exist, the marginalizations that exist. These programs actually help with educating. They educate the African American communities as well as other communities. They're there as well to delve into the healthcare services that's available as well. Okay, so it gives that opportunity to identify some of those healthcare services, as well as we can't forget about the preventative care in the underserved communities and the marginalized communities as well. We have also, we can't also discount the mentoring services and the tutoring programs that's also available when it comes to the African American communities and initiatives that could have an impact. So you have these programs that are there to help, that are there to guide, that's there to support when it comes to those individuals needing the resources and the direction to succeed, whether they're succeeding outside of an educational institution or perhaps inside the educational institution. Okay, all of this, when we look at it as a whole, it is a contribution to healthcare. It is a contribution to education in general. So these different initiatives, These aims are there to help improve health outcomes, and when we think about, in terms of the initiatives, these initiatives could lead to policy reforms. They could lead to different changes. They could lead to more advocacy. They could lead to equitability as well. Now, another question that is a very good question that I thought about was, what challenges have these communities faced in accessing equitable healthcare and education, and how have they actually addressed them? Okay, this is a very good question because challenges exist regardless. They exist. Barriers exist. Obstacles exist. And some of these challenges, just to remind everyone, I think the biggest challenge here in terms of, let's just say, African American, whether we're talking about innovators or perhaps the African American community, would simply be the healthcare disparities. This is no secret. This is part of public health. This is part of, even when it comes to the Affordable Care Act, taking a look at the healthcare disparities, and not just for African Americans, but in general. So some of the challenges in terms of health disparities really surrounding African Americans, we have the high mortality rates. These are death rates, okay, compared to other races or nationalities. And on the same line with the mortality, we have the morbidity. So we have the different diseases, this high morbidity rates, such as diabetes, such as hypertension, such as heart disease, such as all of these different types of conditions or diseases. Other challenges would be unaffordable services. Unaffordable services. Now, some could go on and say, well, I think that's across the board. I don't think that's necessarily pointed towards African Americans, but it is definitely something that cannot be dismissed. And we can definitely say that some of the services are viewed as unaffordable, and even more unaffordable if that person doesn't have healthcare insurance. Okay, so that leads me to limiting, or perhaps the limitation of healthcare coverage. Okay, in healthcare, my healthcare professionals probably already know that when we look at healthcare insurance, most of those insurances for the people who are covered would be through group insurance. That's through an employer. Okay. But then again, if you have maybe a nation whereas certain people are not employed, then of course that decreases the chance of them having healthcare insurance, which decreases the chance of them receiving healthcare and addressing any of these conditions that I've spoke about. So we have inadequate healthcare facilities even within the community. So for instance, if we think about this from a community level, you have some communities where they do have a lot of healthcare facilities, or perhaps facilities that's there. If we're talking about gyms, let's just say, for instance, different gyms where people can go and they can work out and they could, keep their health up, they can keep their exercise in check, they can, get the physical activity that they need. Well, think about this. In certain communities, they don't have that access. So you have where they don't have the facilities within the communities to do this. All of these lead to significant challenges, and ultimately challenges when it comes to access to equitable healthcare. And even when it comes to education in general. Let's jump over to access to technology. Okay, so this is another thing. So access to technology could certainly be a challenge within this community. So now the question is, now that we have identified these different challenges, how do we address these? How are these being addressed? Well, we could definitely say we have what's called, some of us would say, the Obamacare, also known as the Affordable Care Act, the ACA. This actually helps with coverage and reduce the insurance disparities. as well. So you have individuals who are able to obtain insurance. Maybe they weren't able to obtain it a little. Perhaps it was harder before, or perhaps it was limited, or perhaps it wasn't even there. But now you have where we have the ACA, which aims to expand that healthcare coverage, even when it comes to the age of the individual. Others would be the various investments within the African American communities, and even within the infrastructures. Policy reforms, these are really big. Policy reforms are big. I think, at the end, all of this, when we think about equitable or equity, okay, it also deals with inclusivity, inclusive when it comes to access to the healthcare and when it comes to access to education. In terms of what do African Americans communities need to continue, or what support do African American communities need to continue their contribution towards equitable healthcare and education? What support do they need? I'm going to say, from my perspective, resources are critical. Resources are critical. However you look at resources, however you define resources, these are needed to continue the contributions. These are needed. A lot of times people think resources really only deals with money, or, some type of, having monetary funds to continue. That's not far-fetched. We definitely need those types of funds to continue contribution, and those funds need to be at every level. They need to actually be from the bottom to the top, because it can't happen with one person. It has to, be a community. It has to be that community of support. It has to be that community of guidance. That community of help. And it doesn't have to be necessarily within the community itself. It could be in general, because at the end of the day, these contributions are not only for a certain community, it's for everyone. I'm a firm believer that everyone has something to offer. We probably don't have the same things to offer, but we definitely have something to offer. So inclusivity, to continue to, with the resources to ensure success must be there. That investment in mental and physical, as well as, the different funds, affordable healthcare, education. All of this is necessary. All of this is necessary to continue the contribution towards equitable healthcare and education. The last question that I do want to address is looking ahead. So what does this mean? What does this mean in the future? For when it comes to the aspirations of African American communities for the future of healthcare and educational technology. I think it is very important for us to remind everyone, whether it's once a month or once a year, or however, many times frequency it's going to be, for us to remind others to continue their goal, to continue, reaching what they set out to do. So looking ahead, these African American communities aspire to achieve a greater equity. We must continue to do that. Looking ahead, we must continue to achieve greater equity. We must continue to achieve greater access, representation when it comes to healthcare and technology in general. I'm sure many of us have heard of STEM. This is something very big. And so some of these key aspirations, this can range in terms of healthcare from, eliminating the different disparities, very important, and this right here is done through awareness and education. In order to make a change, in order to grow, in order to develop, we have to first admit that, this is something that is here. This is something that we must address properly, so that way we all can benefit and reap the benefits of once it's gone. A lot of, when it comes to elimination of disparities, some people may say, this is systemic. This has something to do with these systemic factors. Whether it's systemic or not, this is something that we as a nation have to get past, because we have great talent across the board that could make everyone greater, that could help everyone in general. So this is where the community, African American communities, they have to play that role in shaping exactly what they want their outcomes to be as well. Also, when it comes to aspiring for educational technology tools and everything, sometimes there will be some limitations, such as socioeconomic status, maybe even where a person lives. Maybe they don't live in, city, or, maybe they live in a rural area. And so they don't have that technological infrastructure that they need. But that right there should not prohibit them from moving forward. So, when we look at all of this, we have to play a role in making the changes that we want to see. And also, we have to play a role in allowing these individuals who came before us, the contributions that they've made that have paved the way for us to be successful as a nation, to continue influencing those individuals that are today. And that right there deals with making sure that we don't allow these healthcare disparities to prohibit or prevent the talent that's out there, that we don't allow, the lack of technology to prevent the talent that's out there, that we don't allow inequality to prevent the talent that's out there. But what we need to do is we need to make an opportunity for everyone, for all of us, to be able to succeed. Thank you.
Thank you for journeying with us today on Keiser Voices, the Story of Success. As we close this chapter, remember, every story has its next page.